Hidradenitis suppurativa is also known as acne inversa, is a chronic inflammatory skin condition in the follicular epithelium of the apocrine sweat glands. Usually it occurs in the area of armpit and groin region, and it is characterized by lesions and follicular recurrence and chronic relapsing inflammation and mucopurulent discharge from that area. And the main predisposing factors are obesity, smoking, hereditary, and females are more susceptible than men. It begins with the defective hair follicle, and later the epithelial cells and the bacteria grow in that follicle, and follicles become blocked later when the neutrophils and white blood cells arrive therein. There's the rupture of the follicle and the dead cell bacteria in the pus is released.
I'm Dr. Shiri. What's your name?
My name is Vincent.
Okay, how old are you?
I am 60 years old.
What's your complaint? What's the problem?
I have pain in left armpit, struggling difficulty on left.
Okay.
Fever, chills.
Okay. Do you feel weakness?
Yes, little bit.
Okay. Do you feel thirsty?
No.
Okay. Could you please tell me your history?
I feel pain one week ago.
Okay.
Then I shaved my armpit.
Okay. So when you're expressing the symptom?
After 5 days ago, pain and swelling, it was too bad.
Okay. So when you decided to go to doctor?
After 2 days of the pain.
Okay. Is it severe?
Yes.
Okay. Have you ever gastric ulcer disease?
No.
Okay. Do you have any allergies?
No.
Okay. Have you ever took blood transfusion?
No.
Okay. Do you smoke?
Yes.
Okay. Do you consume alcohol or drug?
Yes.
Okay. Do you have any family diseases?
No.
Okay. Do you have diabetes mellitus?
Yes, for 34 years.
Okay. Do you had any operations?
Yes, appendicitis about 10 years of age.
Okay. Do you have tuberculosis?
No.
Okay. Do you have stroke?
No.
Do you have myocardial infarction?
No.
Okay. Do you take medicines?
Yes, I take insulin shots for 5 days.
Okay. Do you vaccinated for rabies?
No.
Okay.
The patient has pain in his left armpit. It begins after shaving the armpit a week ago, and he's also having fever and chills, and he does smoke and drink alcohol. He does not have any family history of disease, and he has diabetes mellitus for past 34 years. According to the Glasgow Coma scale, the patient consciousness level is 15 and patient looks normal to his age. The skin is moist, the mucous membranes are moist, and the patient has obesity, and the temperature is slightly elevated to 38 degrees Celsius. During the inspection of the chest, the shape of the chest looks normal, the symmetry of the chest is normal, there are no scar or the wounds present on the chest. The respiratory rate looks normal, which is 18 breaths per minute. During percussion, no pathological sounds are present. During auscultation, we can hear normal circular breathing and bronchophony is normal. After the examination of the respiratory system, we can conclude that the respiratory system looks normal. During the inspection, there is no cardiac humpback or the visible apex beat is present. We can palpate apex beat at fifth intercostal space to the left. After percussion, we can conclude that the cardiac borders are at normal position. The absolute and relative cardiac dullness is in north. During auscultation, the heart sounds are heard rhythmical and regular. We can conclude that the cardiovascular system is normal. There are no scars present on the abdomen. The abdomen is soft, painless, no local tension, and there is no tenderness of the abdominal muscles. We can palpate the lower border of the liver. It looks normal in shape and size. The spleen is also palpable and it's in norm. During auscultation, normal peristaltic sounds are present. We can conclude that the GIT system looks normal. The examination of the genitourinary system shows that it's in normal. There is no swelling, hyperemia present. The palpation is painless, and the urinary output is 260 ml in last 4 hours, and it's light yellow in color. There is no blood present. There is no smell or pus present. The examination of the nervous system shows that it is in norm too. On the examination of the left armpit, we can see red small even patches and the swelling present, and it is tender, size 3 centimeter. The consistency is hard. The lab result shows the high WBC levels, high band forms, and high ESR, and the exudate from the pus shows gram-positive staphylococcus.
Doctor, what is the problem? Why I am feeling pain?
Actually, you have infection in the armpit because of the alcohol and obesity.
We can conclude that the patient has bacterial infection in the armpit and the coexisting disease is diabetes mellitus. For the treatment of hidradenitis suppurativa, we will begin with the topical administration of clindamycin or the oral administration of fourth generation cephalosporin vancomycin. In case of chronic infection, we need to do the surgery. For that, we'll begin with the prepping, dripping, the aseptic techniques, and we'll administer general anesthesia like ketamine through IV, and we'll make an incision over the affected area, and we'll make an intentional wound, and we'll do the debridement of the tissue, and after the procedure we'll leave the wound to heal its own by secondary intention. And in the post-operative period we need to do dressing each day until the wound goes to the proliferative stage. After 7 to 10 days, either we can do wound stitching by secondary sutures or we can leave it on its own to heal.